All right, let's get the meeting started. Good morning, everyone. Today is October the 9th, 2020. It's 10 o'clock in the morning, and this is a meeting of the Topeka City Council's Social Services Committee, so Social Services Grants Committee. I'm the chair, Karen Hiller from Council District 1. If the rest of the committee members would introduce yourselves.
Mike Padilla from District 5.
Christina Valdivia Alcala from District 2.
Thank you. We've got staff here. We have people in the room that are from the nonprofits, and we have a number of people online as well from the nonprofit agencies and from United Way, our partner. So with that, let's get started. We can do some more introductions as the meeting moves along. Our first agenda item is to approve the minutes from July 8th, July 15th, and September 11th. I would entertain a motion.
Motion to approve.
Second.
Moved and seconded to approve those three sets of minutes. Any discussion, corrections? If not, all in favor say aye.
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 All right. Motion passes, and we will move to our subject of the day, which is to review our grant process. This, just to make sure that the expectation is clear, we wanted to allow time to really go through the process well. And so we're expecting to do 2 meetings on this subject. The topics that are on the agenda today are first to review the outsourcing process itself with United Way and with staff and agencies, as much as there is conversation about that, to kind of set the framework for whether committee thinks we should do that again. And then we have the calendar of how that time frame might go, as well as the priorities list that each year has come up. We will see how far we go with those. If the discussion goes fine and we're ready to make decisions on those, or at least preliminary decisions, we will do that today. The second half of that process is to actually go through the process itself, review the application and the scoring, and we are expecting to do that at the next meeting. So there can be some conversation about that if it's appropriate, but we do have a second half of this process. Any questions about that before we jump in? Okay. Well, let's go to item number 3 then, and the discussion of the outsourcing process itself. And I would like to give the floor to Brett Martin from United Way to lead that, unless somebody else would. We'd love to have your feedback on how you think it went from your end. We appreciate your service so much. I'll just lead with saying that it seemed to go pretty darn well. So, with that.
Thank you, Chair. Good morning, committee members and agencies. Thanks for the opportunity to talk a little bit about the process this year. We have worked with the agencies and with the committee to implement the process as it was approved, and at the same time put together a list of those things that were potential suggestions based on feedback that we received from agencies during the process, and also information that we gleaned as we were working through the process as well, whether that was technical, related to EC impact, or whether it was simply the process really beginning with the RFP release and the agency training all the way through. And so we feel like we've received some good feedback. I feel like that the process has been, in as much as we have been able to make it so transparent and conversational. And so, I don't know, Jessica, do you have Any other reflections on that?
No, because I think I would pretty much completely echo everything that you had just mentioned.
Okay, very good. Are there some questions that are still looming out there that may not have been shared in other venues or conversations about this process from potentially from others here in the meeting or even from committee members?
Excellent question. Let me lead to the agencies first. Are there any comments that people would want to make to this group, or that somehow you needed to make and didn't get a chance to deliver directly yet? Anyone? Just raise your hand and we'll get you on.
I have a question.
Okay.
On the grant scoring process, I've asked this question and never gotten an answer. On our grant this year, one of the questions we got a 0 for the scoring, but last year we got a 15, which was the highest you could get. And my question is, why was there so much difference when it was the very same wording? And I know that there was other people looking at the grant and their perspectives are different. And I've sent this question to United Way and to Rochelle, and Rochelle says send it to United Way, and we never did get an answer on that. Can you answer that question?
Potentially. I'm looking at, right now I've got pulled up our response log. Debbie, first, thanks for your question. When was your question submitted? Do you happen to know?
It was actually before the hearings on the appeals, because we sent a thank you letter for approving our grant, and we got almost what we asked for, but we were just curious. We just wanted clarification on that. So it was during that time.
Okay. I'm walking through our response log that we have put together since sort of from May on, and I am not seeing that question. So it's possible that it wasn't included in the log.
I could send that email back to you or whoever I sent it to.
That would be great. Just send it to me. Just send it to me, and I can take a look, and then I can go back as I'm right now. I think I can still, I can access notes from the reviewers, and as much as I have information there, I can give you some clarity there. I can tell you that I believe, based on the recruiting that we did this year, that the reviewers that we had this year have not reviewed for City of Topeka grants in the past, but have reviewed grants for the last several years. So, and met the qualifications of the committee, but also had not done this particular process in the past. So I think if I can get that information, it will help clear it up for you, so that as you're looking ahead, you can understand why that is.
Right, and it was also included in the thank you letter that we sent to you guys.
Okay.
That question was also included in that. So we just wanted a clarification of what exactly you were looking for and what exactly we didn't answer.
Absolutely.
Okay,
Absolutely.
thank you.
And
Debbie,
Debbie,
thank you.
I'm glad you brought that up. Was it by any chance the budget scoring? Debbie?
I don't think it was the budget. I think, truthfully, I can't remember which question it was, and I don't have that right in front of me. But I will send that to Brett exactly. And I think in the email or in the letter, one of the two explained which one it was, but I will double check that and make sure which one it was.
That would be great.
Excellent.
Again, we will get to process and applications and scoring at our second meeting, but
Okay.
people bringing up those questions, and if they didn't before, getting them in to Brett so that he knows what they are. I know that, as it turns out, I've heard at least a second agency that had questions, had issues about the budget one because it had to do with how it laid out the budget and said that pretty much all the money was going to pay for the executive director. And that had been okay before, and then suddenly it wasn't, and particularly for the senior service agencies, when the executive director is everything, obviously that's a fit. So we can talk about that more at the next time, but again, if anybody didn't turn in comments that you want us to think about regarding the questions and the scoring, please get them into Brett.
Chair,
Thank you.
Yes,
I'd like to say something. Debbie, if you could just please CC me or forward me whatever you send, since you're in my district and we know how important that funding is, and I want to make sure that I stay on top of that as well.
Okay, thank you.
Okay, thank you. Thanks, Chair.
well, I'm hopeful that the committee will all get, a synopsis or whatever when we get to that part, so that we are all aware. Not everybody filed appeals, not everybody wrote their questions right away, and so we do want it to be it's a great system. In fact, as far as I'm concerned, when we get to this second session, I want us to hear some feedback. United Way has a different form altogether, and various people are familiar with different ones. We worked really hard on this one. It has worked pretty well, but if there's a better idea, if we are going to continue with outsourcing, especially even if we weren't, if somebody had a better idea, or we've got a section that we want to spend a little more time on, or a different way to evaluate, this is the time. This process is when we start to look at that. So, any other comments from agencies or committee? Mike, you?
Thank you, Chair. I just want to understand, when Brett was giving his presentation, is it in this meeting or next where we will get from him some feedback on lessons learned or tweaks or anything like that?
I think this discussion about outsourcing would be, did that work in general? And so
Okay.
Brent talked in general about the fact that they got a lot of feedback about both the tech as well as the process, and they've been really responsible and responsive and to us along the way, and helpful to us as we went through it. And then if you all as committee members want to change the order, it just seemed like the thought about whether outsourcing at all was working for us would be a good place to start in the review of the process this year, since it was so new.
I don't mean to suggest a jump from one thing to the next.
That's all right.
I just didn't know how deep you were going to go into at this first meeting, because I'm sure that that's going to come up eventually. If we're going to say we want to proceed, we've got to learn from Brett and others how well it did work and what needs to be fixed.
Exactly. Well, with that then, I wanted to start with them, since it was our first time to outsource. Would you rather, actually, having introduced that, loop around any wrap-up discussion on that to the end of our process?
No, I'm fine. Go ahead and keep your
Okay.
agenda.
That's fine. Well, if we could get some input as a committee from those of you who are there, we got the surveys, right, after the application process. We just, as a committee, we need to decide whether we're going to recommend to the council and the city manager that it be outsourced again to somebody, or whether we should keep it in-house as it was before. This was a first time out, and so any feedback to us about whether we should or shouldn't, including from you all as United Way. Obviously, we would be bidding it out again, but, and again, I'll lead with the fact that it went very smoothly, and the transition seemed to go well for the training, for the applications, and so on. Corey, did you want to make some comments on that?
I did.
Please do.
I just wanted to say, the contract says that we can renew up to 4 years. without bidding out again,
Okay.
if you choose.
Thank you.
Just to let you know.
Thank you. As staff, though, would you want to float some comments as well about this transition?
Sure, I think overall the process went great. United Way is amazing to work with. They have been so easy to work with. They've picked up on our forms and our process very quickly. It has freed up some time for staff to do some things that we needed to do that we weren't able to do because lack of ability. So it's really been a win-win, I think, for us, and we're pleased with the process being outsourced.
Okay. Again, this is sort of the chance to say something if it wasn't a good idea or it wasn't working. I am not hearing that, so I don't want to be dragging it out of anybody.
I'll speak on behalf of the agency. Do I need to get up there?
Please do, so that everyone can hear you.
I'm Kathy Votaw with LULAC Senior Center, and on behalf of my agency, I felt like the process went very well. They were very responsive to any questions, and I thought it was. I agree with Corey. It was a really good process.
Thank you, Kathy. Well, if there's not further discussion, that's just fine. We will move on to the next with an assumption that so far so good, and we would be likely to continue the outsourcing approach. And we will go to item 4, the calendar. And again, be eager to have input from United Way about that and our staff, as well as anybody else who wants to pitch in. What Corey has before us, I'll get you to walk through it, but she has mocked up what a 2022 calendar might look like. And if you would go through that, and for those that don't have it, which is most everybody, I guess, give an idea of how the same or different it is from what we've had before.
Okay. I will say that it's pretty much the same, just different dates, but we'll go through. So October, November, we are going to develop the priorities and the budget recommendation for the next funding cycle. So that's our next upcoming meetings. Then in December, around December, the council will adopt the priorities process and budget recommendation. We will have training for the new committee members who might be on in March of 2021 after appointments have been made. The request for proposal will go out April 26th. The application workshop will be held and this is assuming we have a vendor, will be held by the vendor on the next day on April 27th. Applications are due May 28th. By June 9th, we will let people know if they didn't meet the minimum standards for submission. June 25th, or May 14th, sorry, 3 to 5 reviewers will be secured by the vendor, and June 25th, the application and scoring will come back to the committee. July 5th, the committee will meet for approval of the scoring and recommendations. July 16th, the appeal process closes. By August 2nd, the recommendation's ready for City Council. And then the August 24th, City Council adopts city budget. I'm not for sure if that's the exact date, but we'll check on that to get the actual date. That was just an estimate.
Help me with this. We ended up delaying the process in 2020 just because we were transitioning into that. Does this calendar match that delayed process, or does it fall back to what the time periods had been prior?
Actually, we weren't too delayed. We kind of got caught up in the process. So this matches what a normal year would look like.
Okay.
Yeah. We were maybe a month behind at one point last year in the process, but we're able to catch back up.
Okay. United Way, again, this is your first year. One of the things that we figured out for those who weren't involved is that we actually have two sections of the year of the grant making and then the grant management. And so United Way has been through the grant making part, and the grant management part starts as the new grant making part starts. And so with your sense of this, from the vendor's point of view, did the timeline work okay before? Did you all consult about this, or did you just prepare it?
We did not.
Okay,
We
surprise.
just have this as tentative. I did send it to Brett this morning, though.
Okay,
Yeah.
so I
No,
won't hold you
so,
to any answers.
Sure. No, Chair, thank you for the question. The process for us in terms of the timeline, so we're actually used to releasing in the spring, and the grant year starts July 1. So this was a longer timeline. I think for some newer applicants, as Juliet and I have talked over the last couple of weeks, she's received a couple of questions because that was an area of confusion for some new applicants, thinking that even though it's clearly stated in the RFP, even though the information is clearly stated, because the process is so long, I think there was some confusion about when that grant year was going to start, because dollars are actually allocated. I think that's just part of the process. So I think continuing to be able to communicate that very explicitly and clearly to all applicants is important. But I don't feel like it's a compressed timeline by any means. And maybe even moving forward with whoever that vendor is, potentially some almost almost planned communications through a grant management tool like EC Impact that would be set up on a schedule to just remind those who have applied and then those who have received dollars about where we are in the timeline, whether it's approval from City Council, whether it's waiting for the final federal budget, any of those types of things, just to probably over communicate in that way is not a bad idea.
Thank you. And again, if you froze up partway through your discussion about the middle of the timeline, I'm afraid.
Okay.
You were talking about compression versus not, and
Yes.
Were you thinking that this should move faster or something?
I actually don't think that it can.
Okay.
Just based on the budget cycle of the city and the city's those things that are required of the city, but also recognizing that there are federal dollars as well. I don't think there's any way to try to unravel or simplify that.
Okay.
So I think I certainly don't think that it moves too quickly, but I think regular communication with agencies to remind, because the timeline is longer. Certainly it's longer than it is for United Way grant, but we recognize that those who have applied work with a whole host of funders who have all kinds of different timelines, whether it's a rolling timeline, whether it's a calendar year or a July-June fiscal year, or any number of different things. So it's probably just important to communicate where we are in this particular timeline. I think that may be one way to help.
Because it seemed like actually the application and review and notice timeline is pretty tight. It stretches out probably not longer than the United Way one, just because you can't go much faster than that if you give people time to turn in the apps and so on. So I wanted to make sure if you'd had some comment about that I didn't miss it, or that we didn't miss it. Okay.
And we actually prefer for that part to go more quickly. In terms of where it is now. So I wouldn't want to say that we would want to stretch that out.
Okay.
In terms of when the RFP was released and when we and when we make those announcements,
Okay.
that would feel like stretching out a process just to stretch out a process. Recognizing, and I guess this is a question for the committee, but even potentially to you, Corey, without sort of a crystal ball, more looking back at the past, I know that a number of agencies, once they find out that they have, that they are potential recipients of these dollars, they build their budgets around that. And so my question is, in your experience with the federal dollars in particular, have you seen years where those have changed dramatically?
That's a good question, Brett. Our CDBG dollars is what is funding a portion of the social service contracts. We don't see a dramatic change from one year to the next, and feel fairly comfortable with the roughly 67,000, I think, 67,857 that we can put in that fund. So it's pretty okay. If we do receive a cut, we would probably just cut from another line item.
Yeah, I think in the 40-some years we've done this now, I don't think there's ever been a dramatic change. It's just a matter of needing to affirm both the federal money, which we learn about in,
July,
sometimes
August.
Later than August, right?
Yeah.
And then the city budget, again, with the calendar that we have, this group is going to, this committee, before we get done, will recommend to the council how much we think should be in the budget by December. But the budget doesn't actually fit, so even though it will travel, unless somehow the staff or the council early on changes their mind, because we get the council to vote on it, that generally travels all the way through the budget process, but it's not really final until the budget gets voted on in August as well. So it's affirmed at that time.
Okay.
So
Yeah, and so I think for first-time vendor like United Way, even though we had been through successful connections a few years ago, recipients of city grant dollars, when I think about this and I think about some of the new applicants and I think about us as a vendor, we should probably be more explicit about that timeline, because it is a little complicated thinking about federal budget, thinking about city budget, and thinking about those two strands of dollars. So I just think that's a communication piece that can certainly be worked out. But I'm happy to hear that those dollars haven't changed dramatically, because I know just looking at those folks on the screen and looking at the list of everyone who's applied, these dollars are important, and we're all doing our best to try to braid together as many strands of funding as we can to do the great work that we're set out to do. And it certainly puts our mind at ease to know that when we've been approved for something, that even though it's a few months down the road before the dollars come, that it's reasonable to think that those dollars won't change.
yeah, good question. You know, we take it for granted, I suppose, and good, and keep asking the questions on things like that, because again, when the agencies dealt directly with the staff, those reassurances were easy for the staff to answer because they'd been here. And so maybe that's something we overlooked. All right, any other thoughts about the calendar at this point? All right, well, let's again look at that as something that's likely to travel on through, and move on to the funding priorities. Corey, do you want to describe if this is any different?
It is not different. The form before you is the priorities from 2021. Instead of tweaking them, I thought we would just start here and you guys can walk through the document and make changes, and then I'll happily get it corrected.
Okay. So for those who are not looking at it, you've seen it before. Anybody that's been funded and been through the process, there is a collection of categories at the top of it in terms of what the priorities are for that funding. Includes senior services, medical assistance for low-income individuals, programs for at-risk youth, emergency housing and utility assistance, neighborhood and independent living-based services for persons with severe and persistent mental illness, and support services for residents who are non-English speaking. Then it talks about the grants themselves, setting that the minimum grant should be $10,000 and the maximum $25,000. And there are 2 agencies that have been grandfathered since those specifics were set, particularly since the grants were capped at $25,000. And those are the Shawnee County Medical Society at $50,000 and Positive Connections at $35,000. So a higher cap than the others. This sheet allows for new untested programs, but without a set aside for them, and a maximum of $15,000 per program available for programs not established with the city during the last 3 years. And that has shifted a little bit to being for programs rather than agencies in the last year. And then there's a recommended dollar amount, which Corey has put in at the same, which is a total of almost $435,000, mostly general fund in that $67,000 range for CDBG. It comments, though, that the city would accept new applications for new programs, knowing that if funding is exhausted if all the funding is already committed based on scoring for the programs that have already been in the mix, that the new programs would not be funded. It says applications would be scored, and the percentage of their score, it has a formula for how the funding would be allocated, which means that it's not negotiable. It's all set up on a scoring setup. So, and it just says once the threshold is met, the funding will be cut off based on ranking. When I go through that, we did some extra deep dive into senior services just because of some history with the applications and people wanting to learn a lot more about senior services. They are in there, of course. There have been some conversations about the grandfathering over the years, particularly since the dollars haven't changed in allocations, and that the discussion about the new money being for new programs rather than new agencies is a change, a recent one. And then there have been some questions about whether there should be some discretion in allocations and or looking again at the scoring. So if we
Chair?
Yes, please.
I don't know if I have just missed this, but I would like to know, in addition to all the notes that we're looking at right now, what is the amount that's actually been being paid to the United Way?
Yep. It is 21,000.
Even 21,000 even, Corey?
Yes. Mm-hmm.
And we stated earlier that that was not going to be taken off of the top of any of this money. Is that just coming out of the general fund, or?
Well, that will need to be discussed with the city manager, budget manager, on where that money will come from if we choose to outsource. Last year, we had a little extra CDBG, so we used some CDBG and a little of our housing services general fund for the food part of the contract, which federal funds can't pay. So mostly CDBG.
Okay, thank you.
So it was mostly CDBG this year.
Yes.
Okay. Good question.
Thank you.
Let's go back up then as a committee and talk about the I think there are 6 categories. Is there any inclination to change any of those? And United Way, if you have any input or feedback or otherwise, Happy to hear it from you as well.
Chair,
Yes, please.
just a quick question. The six that we have listed here, bulleted, they're not in any priority, right? They're
No.
Okay.
No,
Yeah.
and when we have gotten to, some years past, we had a separation within the way the money was allocated. There was so much there were some contracted services that had come in from other department contracts that we separated, and then we, for some years, had a percentage that was to go to emergency aid versus how much would go to preventive services. And in time, probably about 3 years ago now, that percentage went away. And so there's no weighting or
Okay.
subdividing at this point between like cash assistance kinds of things and preventive programming.
Chair, I do have a question, if I may.
Okay, please.
So as I take a look at these 6 areas, and as I take a look at the mission statement for quality, cost-effective social services to handle our vulnerable citizens with care, minimize victimization and crime, minimize turnover in neighborhoods, and optimize success. When I think about that, when I think about the priority areas, and then I think about the RFP, and then I think about the scoring tool, it seems that those are the polar stars that both the committee and the vendor and the applicants and the reviewers are all aiming toward. That is wanting to make sure that their application aligns with that mission, falls within one of those priority areas, and then to be able to present the strongest program that they can in order to be scored. My question would be for this body, for this committee, are there other expectations that may not be stated in the mission or in the priority areas related to how these dollars are allocated? What I mean by that is you could potentially have, and I don't know because we've not done this, but as I think about this, you could potentially have, for example, 80% of your dollars allocated to one priority area because you had competitive applications that were high, that received very high scores, that were excellent programs that may, for example, all align in one priority area but not in another. And so I'm wondering if this committee has ever taken a look back and said, oh, it's interesting, over the past year, over the past 2 years or 3 years, our allocations have gone more to this area or to this area.
I think that's a good question.
That is a good question. I think that the experience, for instance, that I shared with how this was set up originally and ran for a number of years, where there was a subdivision between emergency aid money and there was a percentage in there, and it allowed, I think, 5% either way slippage. And that did serve as a governor when they ebbed and flowed. But then it seems like there was 1 year where an agency didn't score well enough, and it threw the percentage off. And so eventually, examining that, the committee at the time said, well, let's just go ahead and drop it and let them freely compete, all in the same bucket. There has been some discussion about, for instance, the senior centers have had trouble from time to time, and so, making a subdivision to make sure there was money for the senior centers. Then once again, we had the meeting just to talk about viability of senior centers, and whether that's still the best model and so on. But if one way or another, this group, for instance, wanted to make sure there was an earmark or a set aside for senior services, that's the kind of thing that could happen. I don't know that people have felt like they were disproportional. I mean, we did have a situation where there was a certain agency that was really good at grant writing that was able to add programs and get them in because they weren't a new agency, whereas new agencies couldn't get in. So a couple years ago, the committee fixed that one. Or, I mean, that made it a little more even opportunity. Because
Sure. I guess as I'm thinking about that mission and how it is stated, in order to be able to I guess the question would be: has there been? Is there a need? And again, I'm not wanting to overcomplicate this, but is there a sense with this committee or with the city that we or that you all want to have a broader sense of the impact of these dollars beyond reports, to see whether or not we're seeing, for example, you're seeing potential drops in victimization or crime, or minimum turnover in neighborhoods, or sort of a greater quality of life for vulnerable citizens, because we've invested in maybe these priorities a different way.
I think, Brent, let me try this. That because I haven't been on this committee every year since it's existed, but I was on when it was first created and have been part of the process of identifying what we would and wouldn't fund before. I think, and Corey, you help me out with this too, that the mission statement was kind of the starting block to then have these 6 drop-down categories. For instance, there's an aging mill levy, and so aging services are funded someplace else. Were we even going to fund aging services at all with this money? There is plenty of money. There's money coming for mental health services and alcohol and drug services from other big sources. And so when this has been around for years and years, actually more than just the 10 years that we've structured it a little bit differently. It was, what are we going to fund and what are we going to not fund? And so that mission statement, rather than being a way to test each grant, was more intended to define what we would fund versus, and therefore what we would not fund. Does that make sense? Like I said, rather than having to use those mission goals for every single grant.
Sure,
Okay.
absolutely. Yeah,
I have a question. I have a question, Chair.
Yes.
Brent, I think I kind of get where you're coming from, because, I mean, and wouldn't that take probably some number crunching on somebody's area to look at percentages and all of that? I mean, I'm intrigued at where you're going with this. But I also, in the back of my mind, I keep thinking about how may the funding that we give out need to not necessarily change, but us just to be more cognizant of the impact of COVID on perhaps pockets, or, some of these 6 areas that they may all be equal in weight. But I mean, I keep thinking about COVID in the back of my mind. And then I keep thinking about the number crunching that would be involved with what you're talking about. But I think, to me, what it feels that you're stating means more of a concerted, cognizant responsibility that we would take on by doing this additional insight into what exactly, where everything is going and all of that, which the reviewers, to some extent, they're gathering all of that information, but what we as a committee would actually be looking at. I don't know how much sense it made what I just said, but I feel you on where you're trying to go with this. And I think that there's some validity to where you're going with this. I don't know if that means that we would have to continue this dialogue, because I think we should, but I don't know if my committee members, do. I feel like I'm grasping onto what you're saying, and I believe there's some relevance to it.
I would
Karen, can
suggest
I-
those are good questions and conversation, that the structure that was put in place about 10 years ago now was to require outcomes, that not to prescribe exactly how an entity, any particular applicant would provide services, but it had to be within these categories, and the outcomes needed to be clear and measurable based, and that would certainly be within this mission. And maybe Brent and Christina, if what we want to do is look at whether the outcomes that we've been approving funding for do tie in with this mission statement. Is that
So
what
that's
you're?
where yes,
Okay.
thank you.
Okay.
Yeah, that's where I'm getting. In the scoring tool, which I know we're going to talk about next time, in the scoring tool, there's no way for a reviewer to score whether or not it's a good outcome. It's just whether or not it is an outcome and whether or not they have met them in the past. The larger thing that I'm looking at here, so Councilwoman, thank you for responding there. What I'm actually looking at here potentially is asking this question. When you move to outcomes, what you have done is you've sort of taken it beyond, this is how much we got, and this is what we've done. When you start asking for outcomes, the question that follows from that is anybody better off? Mm-hmm.
So
and as
what?
we are looking at our community, and as we are thinking about funders like Topeka Community Foundation, United Way of Greater Topeka, City of Topeka, when we look at HUD with all of the dollars that are come in through Corey and sort of come through Homeless Task Force, when we look at state dollars, when we look at all of this that's coming into our community, at some point, we ought to be asking the question, as the City of Topeka or Shawnee County or both, we've been investing dollars, we have programs that are doing good work, is anyone better off? And sometimes that's a really hard question to answer. Sometimes it takes years to answer. But I guess what I'm getting to is there may be an opportunity for the city and for some other groups to start aligning those outcomes and start braiding those dollars together in a more targeted way, so that when asked that question, individual agencies, individual programs, City of Topeka, and anyone else can say, yes, actually we are better off, and here's why. Or we weren't better off doing it this way, we figured it out, we course corrected, and now we can say we're moving in a better direction. Does that make sense?
So that would be as opposed to just throwing money at a situation. It's kind of looking at it at a deeper and more holistic, rather than duplication of services, blah blah blah. It's digging in deep to look at it.
Yes, and I think that this committee and that the city, in moving toward outcomes and in looking at the scoring tool and looking at the RFP, has very much been moving in that direction. I mean, I would not say that any of the funders that I mentioned before are sort of throwing dollars willy-nilly at problems, but there's always process improvement there. And the question is it possible to be able to make process improvements in the social services grants process that would move us more toward that, and that then could be part of that larger conversation in the community. And this is a conversation we're having at United Way about our work and about our outcomes, asking ourselves, are we able to answer that question? Is anyone better off? And if we're not, and if programs aren't able to do that, then something needs to change so that we can move in that direction, because we have to be accountable to our funders, but also to the clients we serve, to our community, and to ourselves.
So with that, and man, oh man, this is one of the reasons we thought you guys might be a great partner and vendor. So this is good. Would you be thinking that perhaps with what you just said, that you might not right this second, but have a suggestion for us to rephrase that mission statement so that it would align better with expectations on the outcome side?
I think maybe there's some opportunity for that. I think maybe maybe it doesn't rest in the mission statement as much. Maybe it rests in everything that's built underneath it.
Okay.
So I don't know necessarily that the mission statement, I feel like it's, I mean, again, I'm no expert on mission vision statements. It feels like it covers it, but when you have a mission statement like that, then there needs to be scaffolding underneath it that makes sure that you're always there. So the question is, does this align? Does this align? Does this align? And potentially, I could see, so I know Joyce, for example, in our agency does a lot of work and a lot of training stuff with EC Impact and with lots of other folks with United Way Worldwide and other folks related to outcomes. That's something that Juliet does. That's something that I've done as well. Potentially, we could have some conversation about not only working with agencies on the application process, but actually the formation of outcomes that are more targeted and potentially more meaningful to their work. And again, I'm not saying that that's not happening, but in the spirit of process improvement, I think we can always get better at that. And I think sometimes, I know in reading reports from whether it's United Way or other folks, that I know that there are things happening and great work happening and change taking place because of the programs. But if you don't ask the question and you don't ask it in the right way, you never get that.
And I would ask Brett too, do you see that possibly if the city would go, with that or this committee, do you see that these major funders that you're talking about, including the city, wouldn't benefit if to choose to go that way, benefit from maybe getting together on a semi-annual basis to look at this and see where everyone, the major funders fit in this and get more alignment in this process?
Yes. So,
Okay.
and I'm telling you that even though I want that, you see all the head nods from Jessica, Joyce, Juliet. It's not that we are asking for that. I'm telling you that our program partners, they are asking for that. They are asking. In fact, I have an agency that I won't mention that just last night sent me a draft agenda for exactly that. This organization works in multiple communities across the state and said in Topeka and in Shawnee County, we don't have all the funders get together and talk about all the opportunities that are there for grant dollars, but also even in dialogue that way. And I think that that's something that all of our programs would benefit from, because I think sometimes there is a communication gap between funders and programs, particularly at high levels. So I think we can still always improve at United Way, but we work a lot with our partners and ask a lot of questions. In fact, we have a meeting next Thursday scheduled with all of our impact partners to get a lot of feedback from them on kind of the direction we're going to go as an organization. But sometimes with bigger funders, federal, state, others, there's kind of a lag and a gap there. But I think we could at least start that in our community by having those funders get together and talk about where their priority areas are, so that programs can know about that, but also programs can talk to funders and say, we know that you're funding here. We're telling you from our experience, we're seeing this. And I think it's important for that to be a bidirectional conversation.
And let me just say one more thing in that. I think, again, I believe that is a really good idea. I would have two asides to that, is that one, I believe the big funders do need to get together and get more on the same page. I believe, though, that we also have to remain, if that would ever happen, as transparent, not only to those who seek the funding, but the people that need that funding in whatever way that they are communicated with. So this is not seen in any pejorative fashion. So this is not seen in any way of paternalistic fashion. The other thing that I would say is that if these dialogues start taking place, we cannot, in my opinion, just look at it in the bubble of funders giving and see where the trends are moving, because trends are moved by larger forces than what any of us are about. And again, I'm going to state it until I'm blue in the face. We're talking about living wages. We're talking about, an increasingly older population, the way that our economy is hurting right now because of COVID. So all of these things, even much bigger than the major players and funders, need to be a part of that dialogue. Because if they do not become a part of that dialogue, we who say that we are the major funders are existing in a bubble that has to look at everything that's going on and I'm not saying you bring all of that and talk it to death, but be cognizant of that. But I think these are good ideas, Brett, I really do.
Councilwoman, you're speaking my language. So this is part of that larger conversation about systems that we don't have control over, but that we could advocate for in order to bring about that change. So when we invest these dollars, these hundreds of thousands of dollars as local funders, we also recognize that programs can only create a certain measure of change, that there have to be policies and there have to be other pieces in place and changes in order to be able to benefit our clients, our customers, those we serve. And so the third sort of leg of that stool in the conversation are those who are being served, because they, in that way, are being engaged. It's not paternalistic. It's not saying you can only be a recipient of services and not then reflect on it in any kind of way, more than just a survey, more than just asking you a couple of questions and asking you are you happy about it, but actually engaging you in a meaningful conversation. And so I think those are important pieces. And I will just tell you from the COVID-19 response and coordination meetings that we have had on Tuesdays, beginning March 17th when we started those, I can tell you that there is a desire and a hunger among those agencies that are in those meetings to be able to unify their voice and advocate. They did, for example, on the housing study. They did, for example, in a big mask up graphic to be able to, Amy from Vallejo put together a graphic for nonprofits that we mask up for you. They wanted to put their voice together to help raise awareness in the community. My guess is in conversations like this, when we start bringing partners together and they start looking at their agendas and their work, they may say, hey, why don't we join together and contact this policymaker or these folks and be able to share what's happening here, knowing that it takes a long time to pull those levers, but it is another level of engagement and relationship building that I think will only improve what we're doing. And it's meaningful work. It's not another meeting to have a meeting. It is truly meaningful work.
I'm hearing a couple things out of this exchange. One is that, I recall that when we did our senior focus, we were happy to hand off to you any follow-up on that. We took our own stab at trying to get something like that started here, and it was a rich conversation. So that it sounds like there's some momentum on your end to putting together something that might be twice a year, that would be funders, agencies, and users, and also what I call collateral issues like minimum wage and figuring out what are the things that you're not managing but that others the need to help change the whole picture. I'm also back to looking at our mission statement and what Brett said. What I did was penciled outcomes-based at the very beginning of that line. And what I realized is that that really has two pieces. Outcomes, let's say we add outcomes-based, but if it says outcomes-based, quality, and cost-effective, those were our measures for perhaps ranking the proposals. And then the rest of that sentence was the kind of the summary statement for what categories we thought that our predecessors thought that our city dollars should be targeted at. And if I'm not hearing any discussion about changing that right now, but if we go back to what both Brett and Councilwoman Valdivia Alcala were saying, if outcomes-based quality, which I think the prior committees thought was maybe enough, and cost-effective, which is something we have talked about, the fact that we've not necessarily addressed very well in the form that we have, if those are the three things that we want to focus on as we look at the actual application and scoring, or at least I'll use them as a framework for how we measure what we want to fund. Does that start to pull together some of these comments? Okay.
Absolutely. Thank you,
Okay.
Chair.
Well, if I'm not hearing any, if that's tentative for that section, and I'm not hearing any suggestions that we change what we fund, let's move down on the sheet to the minimum, maximum grants and whether we want to continue grandfathering. Obviously, what has happened is as we've added new programs, and if they've scored well, that has pushed other programs out. That was part of the intent of the committee years ago, to give some dynamic to the funding so it wasn't just going to the same agencies every year. I'm just throwing this out to get conversation going at least. The dollars have stayed pretty much the same for the last few years in terms of what the city has put on the table. So it hasn't allowed for any growth dollars. On the other hand, these dollars are pretty much, have been intended in the past to be core dollars, so that an agency could count on them every year as long as they were doing a good job and did a good application, and could use those to leverage, to fund core programming so they could leverage other dollars for new programs or for additional funding for those core programs. So, and it's worked. Oh, we went through a couple of years, some years ago, where people wanted to fund new things, and a lot of those fizzled, and the core agencies had found their core funding in jeopardy, and so kind of went back to that core approach, which seems like it's going all right. Okay, now, any conversation?
Chair, so I think that as we start having those conversations about outcomes and having those larger conversations and being able to demonstrate the impact of these dollars, I think it will be very important for the city manager and city council and budget folks to be able to hear that, because all of us in this work want to have the best return on our investment as possible. We're in a nonprofit, world here, which means we're not in the for-profit world. It's not about making money. It's not about that, but it is about creating change. And I think that I'm happy to hear that those, that those dollars have maintained. And in order to be able to keep them maintained, and even to potentially talk about increases in the future, I think if grantees were better able to collectively demonstrate the impact of city dollars, I think that only makes the case stronger, and it only makes the story our community tells stronger.
Thank you.
Okay, I'll do it.
Okay. Kathy's coming to the mic.
I'm with LULAC, and of course, I'm going to advocate for grandfathering in the senior centers, but I see that that is a huge issue. Because I believe that accountability with any kind of funding is everything, and I'm not so sure that measuring, I think somewhere along the line of grandfathering in, you're going to lose the measurement that Brett was talking about of what are you doing and what is it showing and how many folks are being impacted by that. So I'm kind of flipping back and forth on this. I know that for my agency, the city funding is really important. But it is a core funding that opens the doors for a whole lot of other different things. And we're continually looking at other funding because there's no guarantees in life. We all know that. And that comes with any kind of money all the way around. So for my fellow senior center folks, I advocate for that, but I also feel like that our accountability would not be measured properly, and there would be big issues in that. That's just my opinion.
Thank you. Corey?
I just want to make sure that we're clear when we're talking about grandfathering. That means they have a different maximum amount that they can apply for, but they're still getting graded and going through the application process just like all other applicants. Just wanted to make sure that was clear, that it's not an automatic, they're getting funded regardless. They're still going
That's
through.
true.
Yes. Just what.
But as the dollars stay the same
Yeah.
in the pot, if you will, then that ability to get more of them compared to others,
Sure.
and whether those are more important or why it is. I mean, we can go back. I'm not. And try and discover why committees in the past went ahead and, if you want to call it grandfathering or preserving that higher level, whether that should continue or not. I know it's been discussed before. It loosens up, it levels that playing field. If we did that, as long as those agencies know that change has occurred, they've got time to do what everybody else does and come up with other funding.
Chair,
Yes.
I definitely believe that after, was it last year's, I'm losing track of time, what I feel was a debacle to some extent about the way that the senior centers lost funding based on, the grading, and the majority of those were in my district. But beyond it being a district issue, we know how deeply these services are needed by our seniors. And at the same time, understanding that every dollar that we give out, which is oftentimes taxpayer dollars, needs to have accountability attached to it to provide our seniors the best when they go to these centers. So I would be for grandfathering. I think we still need to have, deeper conversation about it. I don't know if there's enough time to have that depth of 45 minutes. But I could see myself definitely supporting a grandfathering. At the same time, with the two agencies that we have listed at 35,000 and 50,000 that are grandfathered in, I recall the presentations that were made. I'm wondering if there is any way that we might be able to have something bullet point that actually gives us a hard copy rather than trying to get to minutes, which are not often verbatim, which aren't verbatim, so that we as a committee can see what these two agencies that continue to be grandfathered when they made the presentation, if we can have something on hard copy that delves into that more, that we can like always have access to. Does that make sense?
To a certain extent it does, except each year things change. And so would you really want to be going and looking at 2 years ago's presentation, or do we need to consider it fresh if we want to consider it? Would be my question back to you.
Yeah, I don't know. I'll have to think about that, Karen.
Okay.
But this is all just so vital, right? Because that's like, what is that? 85,000 a year for 2 agencies. And I'm not saying that it's not worth it. It may absolutely be worth every penny. And that may be due diligence on my part to become more versed, in this way. So.
What it does is raises how much they can go after, but the differential is $40,000 that gets reserved, if you will, for them and is therefore unavailable to the other agencies or for other transitional programming, new programming and vitality. So.
Yeah, so we're just having the conversation. So I think it's definitely gonna take more research on my part. I do it.
Okay.
That. Thank you.
Well, do you want, this is, again, we want to be methodical about it. If it takes more than 2 meetings, that's okay too. Would you want to consider at our next meeting having a presentation about that? Or do you just want to consider without it, or what? What do you want to do?
How long ago did we have that last presentation? Wasn't it just this year? I think we did. We did have the presentation by him, I thought.
This is my first year back on the committee. It didn't happen this year, but it might have happened a year ago when the last year's committee set the priority sheet and recommended it to the council. So it's been a year.
So yes, I would say yes for that.
All right. Let's count on that for next time then.
Chair?
Yes,
if
yes,
I
sir.
may. Following up on what Corey's comment was, I think for the general public, it would be good to know what the difference makes in designating an agency as being grandfathered. Because I do think some people think that means an automatic dispersal of funds. And I think there needs to be a clear understanding for the public, because they will be the ones who respond to decisions made, that they understand that by changing the status of an agency from to a grandfathered agency, how that affects their standing as they compete with the other agencies for those available funds. And so I think maybe that's part of that better.
Maybe we just use a different word.
Well,
if we decide to give somebody a higher allowance than everybody else.
Yeah, because in many aspects of life, when you say grandfather, that means, oh, you got to pass, or, it's
got it. I think we need to get rid of the word. Sounds like we need to get rid of the word.
And so I think that's.
I agree.
If anybody is in that bucket.
Well, it's just something that I think is important. I'm glad Corey brought that up, because I do think that there's a general misconception in application.
Yeah. And what it really means is that a past committee said that they thought that for what they felt were good reasons, these agencies should be able to get more money than anybody else.
If I can. Yeah. Good morning. My name is Megan. I am the new director of Health Access. So I can hopefully give a little bit of history, even though I haven't been intricately involved in the past grant cycles. We have historically, many years ago, had been funded at a much higher rate. So it's not necessarily that we've been given kind of this automatic bump. We've been cut over the years. And so we have gone from 125,000 in possible funds all the way down now to the 50. And so, talking about outcomes, which is, outcomes, this conversation, these are good conversations to have because it does, make sure that the city's dollars are being spent very wisely. Our outcomes, no, you're good. Our funding goes directly towards prescription assistance for people who otherwise have no health coverage, no health insurance, no way to get this, vital prescriptions. It allows people to be able to utilize the other services and the other things that are in the community and not have to worry about heart medicine, diabetic medicine, all of these different medicines that are so greatly vital and needed is what these fundings go towards. And so I'm more than happy and willing to present next meeting on the different bullet points and really pull out some great data for you that can lay out all of the great outcomes that our program does have.
Thank you. What you're talking about points up two things that I recall from process. And one is that it's a little more challenging to use that. An outcomes model is generally often looked at a longer term than immediate care. And so the outcomes are a little different for the medical assistance, which is immediate, and emergency housing and utility assistance, because it is only immediate. You don't know what's going to happen next month or whatever. So there's a challenge there. But the other thing, and it's true for any program, but let's use yours since you're standing there.
Yeah.
Is we have never built in a component where the reviewers evaluated whether there were other sources of funding, whether ours needed to be as exclusive or primary as it was. And that's a tough one to do. United Way does more of that than we have. And so they might have some thoughts when we get to the applications and the scoring. I remember prior conversations with your predecessor in terms of a choice that your company, and maybe this has changed, but for years did not ask the doctors, the medical community, for money. And maybe that's changed.
I mean, we do ask, absolutely. We have a yearly fundraiser, and that is very well supported by the physicians that not only donate their money to our program, but they donate their time. Any time that is spent with a patient that they are seeing is a loss of income for them because everything is 100% donated. And it's not just that meeting time, but it's also goals and metrics that are laid out to them from their employers that they are going to miss potential bonuses. They're going to miss potential incentives and things that they might need to meet because all of their time is being spent completely free for us. So it's not just their money that they are donating at our yearly fundraiser, which was canceled this year because of COVID, I know. Yes, and so thinking about COVID and the impacts that have had on our organization, they've been wide, they've been huge. I've been with Health Access now for just about 5 weeks, so I'm very new to the program. Not new to Stormont Vale, which graciously donates so much of their services to us as well. They donate their building space, they donate their HR services. There's so many great things that we do have donated to us that this is vital money to our program. But we do so much with so little. And $50,000, I know, is a large portion of our budget, but that budget goes directly towards patients because everything that is most of everything else is provided to us through donation, and it might not be an exact dollar donation, but it's also missed dollars from those physicians and those from providers that they're not getting because they're donating their time to us.
And part of the discussion has been that most of these other agencies use a lot of volunteers and people who donate their work or their personal time as well, and raise money from other sources. And so to be able to differentiate those.
Yeah, we do have different funding sources.
Judgment call.
Yeah, it is. It's hard. It's a hard way, but when the physicians are donating their time to us, it's not their personal time. It's their employer's time that they are also donating. So it's I think that's important to remember and factor into.
Well, and our other grandfathered agency, if I recall, the last time I was advised about it, it was that their mission has changed some since they first started getting funded by this source, but also the way I think it's a federal grant that they get, that I think we're paying a substantial amount of the match. And whether other people are using match money too, or raising the rest of their match money for their grants. And so it's a tough conversation, but to reevaluate
Oh, yeah.
whether
It is.
one
Yeah,
is.
it's hard, the prescriptions we're able to provide for our patients, they also pay a copay. It's a $7.50 copay. It's not a large copay, but for some patients in our system, they don't have $7.50 to put together for something. And so looking at the possibility of having reduced or less funding, we'd have to raise that copay even more. And so that's something that's to factor too, is looking, because we do pull in from other sources and we do work with other agencies, and we're looking at new ways, and especially because of COVID. I mean, I can't tell you how many applications I have taken in the 4 weeks since I've been at Health Access I don't have a job, I lost it because of COVID. And so people are losing their health insurance, they're losing their way to stay healthy, and they're turning to us. And so we're having so much higher of a need. And then when we talk about having our needs go up and our funds go down, it's hard to be able to continue to serve all of those different patients. So.
Quick question, and then we may need to get back to these, but I mean, a number of agencies were able to access COVID assistance money. And was yours one of those?
No, because we are donated. The physicians donate their time. So we're not a payer source. So we don't come around and turn around and pay insurance companies. We're considered a community-based organization. Now, we did apply for the community-based funds that the city had put out, but we did not receive any of those funds.
Okay. We're all just,
Yeah.
like changed the whole universe in terms of all
Yes, it did.
the things people individually and agencies could do. Just checking.
Yeah, no, I appreciate that.
Yeah.
Thank you.
All right, thank you.
Yes.
Thanks for speaking up. It sounds like, I don't know if the committee is satisfied that that's enough of an update, or if you'd like Megan to come again next month. We do want to invite Positive Connections, it sounds like. Do you?
Agreed.
Okay. Well, maybe you'll be here next time anyway.
I'll be here, yeah.
Okay, good. Discussion about the 10,000 minimum, 25,000 maximum at this point. If not, let's move on as a committee to the new untested programs. Right now, it's yes, we'll do them, but it's a maximum of 15 for any new program, whether it's from an existing agency or a new agency. We didn't have enough money to fund any new programs this year, did we? Yes, we did.
Can't recall, sorry.
I think we did.
Yes, we were able to fund some. I want to say there might have been a handful of them, possibly.
Yeah.
Up to, I think about 5, but don't quote me on that. I don't have it in front of me right now.
I can figure it out, maybe. Yeah, any of them that had a maximum score of 70 were new applicants, right? One,
Joyce, you're nodding your head. Is that
two,
correct?
3, 4. 5, 6, 7. 7 new programs. Okay. We did. Any thoughts on that? Committee members, others?
Chair, just a question of clarification on this related to the 3 years. So is the 3 years, so is a new program considered a new program for 3 years, meaning that their cap is 15,000 for those 3 years, just as a point of clarification?
That's a good question. I think the idea was that that was just an entry threshold, that once they'd been funded for a year, they were, by the city, that they were then a continuing program and were eligible for the 25,000, Corey?
I think that might have been the intention. I'm not for sure that the sentence here reflects that. We might need to revise it.
Or just
State
the
that.
wording?
Yeah, the wording.
Because it was, the idea was that it hadn't been funded by the city, rather than that it hadn't existed as a program. Corey?
Yeah, I mean, because it says the city during the last 3 years, so that would mean every time they applied for 3 years, they would be a new program. Right? Wrong?
Well, that was the question.
That's how I read it.
That's how you read it?
That's how I'm reading it.
Okay.
I'm not for sure if others are reading it that way.
I was thinking that this was a carryover from when you all were, you know, the scoring kind of thing, that if they didn't have actual history with the city itself, not that they existed in the city, but that they hadn't been funded by the city, that they wouldn't get as much their first year. Brent, do you have?
Well, I seem to recall I didn't, you know, I haven't been intricately involved in all this, but what I remembered was we established it at 15,000 for the first 3 years that they would be funded, primarily because outcomes had not been quantified. Because when they come in, they make a plan. This is what we will accomplish as a new program. They outline their outcomes, and we wanted 3 years of history in order to verify that their outcomes are good on a continual annual basis.
Okay.
And so that's what I remember being told by discussions with Sasha on this program.
Well, it does say new untested programs is actually the full heading.
Right, and so I think the intent was that they would show 3 years of outcomes to prove that they were a qualified or a quality program
Successful.
that
Okay.
is accomplishing the right things as they say they will. And then from there, they would then be able to move to the next level. Now, obviously, you could adjust that to 2 years if you really thought that 2 years of outcomes was enough. You know, you could make adjustments to that. But I think that's why it was stated the way it was, is that we wanted to verify 3 years of outcomes to really prove they were a program of success.
Thank you. Appreciate that. Well, and I know that discussions along the way have been that it's easier to get startup money than it is to get maintenance money. And so for new programs where people are excited about seeing if they'll work and so on. But you gotta continue it if you're proven, so. Brett?
Chair, just a point of clarification there. So are we talking about 3 consecutive years? Or are we talking about 3 cumulative years? Again, I'm just wanting to make sure that for whoever that vendor is, or for the committee or anyone else, that the language is clear in a way that there isn't any misunderstanding. So that is it 3 consecutive? As I'm looking at that, it says during the last 3 years. So I just want to make sure that the language is as clear as it can be for applicants, but also for those who would be providing technical assistance.
Well, it's also interesting that now that we're doing a deep dive into this, it says new untested programs. And there's a difference between a brand new initiative and one that just hasn't been funded by the city before. Because some of our new applicants were not new untested programs. They were programs that had been around. They just hadn't had money from the city.
Yes, and that's actually, we actually did get feedback on that from programs who said, we have outcomes. We've reached those outcomes. But the question was, did we reach our outcomes as a city grantee? And
Right.
The answer was no, because we haven't been a city grantee, but we can demonstrate that we have in fact met the outcomes in our application with other grantors.
Right, and that really was something that, that I know has been a question on my mind, but that's come up before, is just because they didn't have a track record with the city, if they did have a track record elsewhere, sort of like checking references on a job or a contract, why couldn't we check those references or verify those rather than either, you know, we could still start them low, but there's a difference between the, you know, if we still don't want to give anybody more than 15,000 if they're newer and protect a little bit the carryover agencies. Those are two different things, though. So
Yes, Chair. I would say that as we're talking about this is part of that larger conversation about outcomes. Is that if there were conversations among partners and then among the committee about outcomes for these areas, we may be able to clear some of this up. Not to say I have this figured out.
well, it
By
sounds
no
like we've
means.
got a couple
But it is part of this
different moving
conversation.
parts in this one.
Yes.
Is there, maybe it's just uncovered too fresh for people to have a recommendation. Does anybody have a recommendation on what it should be off the top of your head, just to consider? Yeah, I mean, what I'm hearing is should it be 15,000 as a threshold for any entry level new to the city, no matter whether it's a new program or not? And does that stay with you for 3 years, or should it just be 15,000 for that first year, no matter who you are? And do we even want to, the other thing is, if we don't really want to do brand new programs and we want a program to be at least 3 years old before we would take it on at all because of the focus on sustaining funds, we could just not do new programs, I mean, brand new programs.
Chair, I would say that where we are with, you know, the city budget and where we are with stretching dollars, still right in the middle, it feels like, of COVID, that I think that we should have a little bit more caution. I'm sure that there are other large funders out there that would be open, especially perhaps as we start this dialogue that, you know, we're envisioning about maybe funding new programs. But as a committee member, my take would be on playing it safe and going with established programs rather than brand new programs.
So your thought might be that that a program would need to be at least 3 years old before we would take it on, or at least 2 years old? I'm just throwing that out for you. So tested, not new, untested.
Not new, untested.
Uh-huh.
I would say 2 to 3 years is I would say more like 3, but that's just me. I'll go with what we continue to discuss on. But brand new, untested, I do not think right at this time is the best way for us to use our dollars. Taxpayer dollars, I'm sorry.
Well, if it was going to be 3 years old, then you get into, 3 years old by the time they get their first funding, then they'd be 2 years old that year out. Well, enough time to have some outcomes. I mean, to have done some program, to have demonstrated their bookkeeping, their ability to frame an outcome and an output, know the difference, and see how they'd gotten started. I mean, if we said 3 years, they'd have to be 3 years old to get their first funding, then they would be only 2 years old when they applied in the first case, or if we wanted them to have 3 full years of service before they even applied. just thinking a lot of times your startup is 3 years worth of funding and you need that takeout funding by year 4, for sure.
Chair, so I would just say, I think this goes back to that larger conversation about the mission and about where the committee sees the purpose of the dollars. And so if the purpose, if the purpose of the dollars is for core, or if it's to be supplemental, or those types of things, I think this is exactly the conversation that needs to be taking place, because it helps sharpen that that scaffolding under the mission.
I personally have always been inclined toward core. Of course, I ran a nonprofit where I knew how hard it was to keep that core funding and how much it meant to being able to add new programs or just to sustain and replace funding that came and went. From what I'm hearing, and this is all tentative, which is good, we'll just keep building on this, but if there's a sense, I'm looking at you, Mike, because you haven't been talking, but if it's core programs and they need at least 2 years of history before they applied, and still, if it were that, I'm looking at Christina at this point, 15,000 for the first year, and then you'd go to the full availability after your first year of performance under our grants? I'm making that up, so.
I would, I'm saying yes, but just believing in the importance of, what Brett is saying, but knowing that we have to, set this for next year.
Right. And we can just pencil this and we can all think about it. This is really good discussion. This is why we do this.
Yes, then I would say yes. That's, yes.
Okay.
Yes.
Okay.
Chair,
Yes, sir.
I think a good point was brought out by Brett with regards to consecutive, cumulative, and also the thought about being in existence or being in a program for 3 years, but not established with the city.
Right.
That's, for me, the one that I think bears a little more conversation.
Okay.
And maybe not today, but that larger conversation that like Brett suggests, because, if you've got a program that's been out there working well, they can show you the outcomes, they can show you everything that they would if they were in competition, but this is their first year applying for the city. I don't think that they should be just at a lower level of consideration because it's just their first year with the city, because they've already got a past track record before they came to the city for funds.
So just take that all out and just say you have to have at least 2 years of program history before you can apply, and then leave it all the same, the 10,000 minimum and the 25,000 maximum?
That's where I'm thinking, but I know that the wording that's in there is that the city probably set the standards, and so if you've met the city standards, then that would give you some level of consideration over some other organization. And I don't want to just open the door for programs.
Well, I think you're right on it, though, because
Yeah.
that was sort of a convenience thing in a way for the city staff. The way they wanted to do it was they wanted to be able to check their own records and not have to go anyplace else. And so it had been the staff recommendation to have that entry level, not exclude it, but have that history. So if they were documented outcomes, if I'm hearing
Yeah.
you, that if it was an established agency, just not funded by us, and they could provide those, otherwise they're not going to be competitive and they won't get funded.
Yeah.
So there would be no more differential between the 70-pointer and the 100-pointer in your case. They'd have to bring all that history from wherever their prior source is.
That's where,
sources,
yeah.
and just be fully competitive on the same level as the ones that had been funded before. So maybe maybe it would kind of take care of itself by how many points they scored on their application coming in that case, with the system that we have.
You have some thoughts on that, Corey?
I think either way will work fine. I particularly think it's fine the way it is, and I think it during the last 3 years makes it consecutive. But yeah, I mean, staff would have no problem getting outputs and outcomes from another source, so we don't have any problem with that. That we could just make that part of the application process.
Yeah, I agree. I would have made the assumption that the 3 years would be consecutive, so it'd show a pattern of progress and sustainability. But that can be accomplished outside of a city program. And then once you felt good enough about it, about the program and what you were doing, you would want to bring that idea to the city and make your presentation just like everyone else and be competitive at the same level based on your performance outside of the city.
Well, part of what you
Program.
couldn't score was like the grant management, the city staff scored, you know, the turning in your reports on time and accurate and things like that. You'd kind of have to check a reference on those, I suppose.
Yeah, and it might take a little more work doing that, but I would imagine, just like we expect the others to keep records of minutes and finances and have them all in place and not make an assumption that they've done it. It has to be documented.
Yeah, and that would, what you're proposing would take care of the issue. I mean, we have had some agencies that somehow didn't hit their scoring, so they dropped out for a year and then they come back. But if it's the operation of the program only, it doesn't matter whether you went in and out of our funding. I think, if I'm
Yeah.
following what you're suggesting, makes it a little simpler in that way. Well, we'll tentatively see if we can get that down in a draft by next time, and let's move on to the funding levels.
Chair, if I may.
Yes.
What did we end up with?
Oh, well,
I'm sorry.
I think the tentative is that it would be, and you committee members, tell me if I got it wrong, that we might be looking at a single class of agencies that you have to have, you're applying for a program that has been in operation for at least 2 years prior to the date of application. Minimum grant would be $10,000, maximum $25,000. And that's it. And we would have to then still decide about whether we wanted to provide those two agencies the higher level of funding that they could apply for. But that would really strip out everything else from that section if we did that. Okay.
Chair?
Yes.
Just a question on that related to the 10,000. The wording there is
Oh, yeah.
minimum grant amount 10,000. We had a number of agencies this year based on the percentage who in the actual final grant award fell below 10,000, 4 of them in fact. So the question is, on that minimum grant amount, is that minimum amount request?
Thank you for bringing that up.
And is that easier for us?
Well, let's take it one more round with you on that. The reason behind that when it was established was the idea that in terms of the agency as well as in terms of the grant administrator, that it ought to be at least $10,000 worth of product to make it worth everybody's time. But then when you do those calculations, and there was a misunderstanding before when the when the scoring dropped into those grants. And so, and it's happened before as well, not just this year, where it went below 10,000. And so it's a really good question, because if we said the minimum grant would be 10,000, then you'd bring the bottom up when the scores, when we started running out of money. It could be done either way.
Chair?
Yes.
So is it the suggestion, maybe from Brett, that it's worded, the minimum request is for 10,000 rather than the minimum amount?
Well, we
awarded?
needed to sync it up because this didn't match what was in the application form, right? And so they, as a first-time vendor, didn't thought it was just a request.
Okay.
And so they went ahead and made awards that were less than 10 or recommended them, and by that time it was out.
Okay.
So we just need to clarify it. But that was the reasoning for the 10,000, as I recall, is if there's any reaction to that at this point from anybody. That it just was make the grants big enough to be worth the agency's time to manage all the reporting and so on, as well as the city's time for managing it.
Chair?
Yes.
I wasn't on the committee when that decision was made. I'm sure Corey was around for those discussions. And that was my understanding, is that why it was suggested is that,
Okay.
that to make it worthy of time, consideration, and all the things that staff had to do, that it needed to be a significant, at least a minimum amount there to really give that consideration to an agency. Is that really
Yes.
where it was? 'Cause-
Yes, that was a dialogue.
Yeah.
And the risk you have when you do that is that somebody will pump up their grant
Yeah.
application to be more. I don't think that's happened, although we did have some people that turned in applications for less than 10 that did not get, didn't we have one or two? Or maybe that was, no, yeah, we did. And they should never even have been accepted for the process, had that been clear. And so that also is a learning thing for our vendor. So what do people, if it's a minimum application, then the score could bring it down to like 85 or whatever, depending on what the threshold is. Or we could simply keep it that the minimum grant would be 10. Brett?
Yeah,
Brett?
I would suggest 10. Just keep it at that. Otherwise, we might end up doing what we say we're not going to do, funding, these really small grants that shouldn't even be a part of the process. So I would say sticking at 10 even.
Well, if I may, city manager, if I could ask, does that have any repercussions in how we're looking at the monies that we're going to set aside? It shouldn't.
No, I don't think it does at all.
No.
I think it's really determining, as said, you want a certain level of grant that goes out to make it worthwhile for each organization to know they'll be receiving a certain amount of money if they make their application and they have a program that would utilize that much money. I think that's best. And also, I think on our side, to have them going through the process to have that there are applications for a certain amount. And I think, too, most programs, you're looking at an amount that hopefully would make a difference as a match for them or whatever. So it kind of needs to be a substantial amount. We don't typically would want give out small grants of 1,000 and 2,000, for this type of programming that we're talking about.
Thank you, sir.
What would have happened this year if we had had that minimum is that when I'm looking at the grant awards that were made, there was about $3,000, a total of the ones that were funded under 10,000, it would come up to about 3,000. What would have happened, I think, was that would have knocked out the lowest scoring agency of all of them because there wouldn't have been enough money. If the other ones had gotten $10,000, then there would have been one less agency funded and we would have had a little money left over. Correct? So that's what
Yeah.
happens. I mean, if you're going to level up those lowest ones, then, or if their scores, I mean, if their scores ended up bringing them under 10,000, they either wouldn't get funded at all. That's the other way. In which case, these 4 that were under 10,000 wouldn't have been funded at all. So we would have to figure out how we wanted to handle that minimum award. You see what I mean? I mean, the 4 of them scored based on their request, and then they're 10. And up the first 3 of those 4 to 10, and then there's not enough money for that last one to do it one way or the other. Unless somebody else
Chair.
has got a better math calculator. Yes.
No, Chair, that is the case. My contribution to this, I would be really eager to hear from programs in this to ask. So obviously the 4 that fell below 10,000, none of them said no thanks. To the
Never.
They all
Never.
accepted. My question is, would be for these programs, if it would dip below that 10,000, is that still valuable, sort of meaningful dollars for them? And even if it's core, it could be, for example, for a small program, but that, say, 9,500 or 8,700 or whatever the case could be, not necessarily for the current ones, but potentially for future ones, could be enough to have some significant impact. And so I guess I would be, as I'm thinking about this, I would just want to hear from programs in that way. And I know we've got just a few left, but I'd be interested to hear.
Well, and we did in the appeals, we had that conversation with the Center for Peace and Justice, which had asked for a lot of money, which won't happen again next time. But even so, we said, well, is this enough money for you? And their response was, we can use that for facilitators for X number of programs, and they did think they could really put it to good use. I might not have repeated that quite right, but you got the idea. They, it wasn't going to fund a salary or anything like that, but they felt like they could.
Yes, I think the other thing to consider here is that I don't know that we I'm trying to think through the application. I don't know if we ask about leverage or match, but these dollars could potentially be match dollars for other dollars, so that a program could potentially leverage $8,000 of city grant dollars as a one-to-one match and end up being able to leverage another 8,000 through a cash match or something like that. And then that 8,000 becomes 16,000, if you will.
Let's, we're getting close to noon anyway, but this has been really good conversation. It drives back a little bit to the fact that we've really never had a good budget assessment element to our process. And what Brett has just covered could make the difference in kind of what our final thoughts were going forward. So it sounds like people, at least in terms of the applications, 10 minimum and 25 maximum, people we're still okay with. So let's plan to revisit the issue of that the minimum grant amount as we finish this. When we go through the scoring and application process, it may talk to us a little better. With that, the other thing that's on this front sheet, and maybe we should hold it, but is the issue of whether your percentage score is the absolute driver for how much your grant is. Is there some conversation right now just to kind of get our wheels turning before we wrap up on whether people think that that's and United Way, I don't think you do it exactly that way. And so your experience with different processes and final awards might be helpful for us in that case.
Yes, Chair, thank you. So our process does function differently. And it can certainly inform this discussion. So when the reviewers get together, the panel that we call them in United Wayland, when they get together, they go through a facilitated conversation. They look at the scores, they have discussion, and then they look at the total amount that's available, and then the total amount requested, and then there's a difference, and there's always a difference. And then they move through a facilitated process where they determine where the dollars are invested based on all of the conversation they've had before, based on the rubric, based on a ranking tool that they use as well. And so given this process, I think they're different enough that I don't know that that process necessarily informs this one, but that's at least how that works.
Do they actually interview the applicant agencies in United Way in your process now?
So maybe way back in the old days, they did with citizen review panels. But what we found is that we're simply unable to do that. If we gave, for example, every organization 10 minutes to present, and we had 30 applications for food assistance, that's 300 minutes without transitions. That's 5 hours. Nobody wants to sit through that. I will tell you, though, that we do have an opportunity and a window of time where those who are scoring the applications can submit questions to the applicants, and they are asked to respond within 24 hours, so that if there's opportunity for clarification, or if there are questions and things are unclear, there is opportunity for clarification. The other thing that we've considered, we've considered all types of things, but the other thing is sometimes a presentation can be slick, but and certain people might be wooed by that, but the program and the application might not be as strong. So there's lots of pros and cons back and forth with that, and we've had lots of discussion about that. But no, there's currently no interview, but there is a back and forth via email if there are questions.
Okay, well, and you're touching on the reasons that the prior committees came up with this, that, if it was more empirical and more fair to have the application be very clear and work only from the application, but further score it and only use the score, and that way there wasn't to keep the subjective or favoritism or whatever it might be out of it. That was the goal of the committee in the past. But we know that by partnering with you as a vendor and with your experience, there might be some feedback for us. Again, what that did, though, was get questions like, are there other funding sources that you could approach, and how do you score that? Or, and there was a question in our proposals for a while about, are you under a strategic plan? Are you doing some reconsideration internally of your own programming and planning and outcomes, or has some other funder asked you to do that? Which is a little hard to score, but is very important to making a good decision about an investment, arguably.
Yes,
So,
I would agree with that. The difficulty then is that then that puts more of a burden on the reviewer,
yes.
who already has a significant task ahead of them to then be able.
Uh-oh. We timed out.
Applicant's strategic plan and their adherence to it, maybe. So.
Okay. We missed a little bit of that due to a blip on this end.
Looks like the city is on mute.
Oh. Sorry, we got disconnected for a minute.
Okay.
You want to run through just briefly what you said again?
Oh, sorry. I said that it does put a burden on the reviewer and the reviewer already has a significant amount of work to do, and then that would put the burden on that reviewer to determine the quality of the strategic plan and the agency's adherence or implementation of it.
With that, I think we should probably keep that in mind, because we're going to spend more time next time on the on that process and with what the application and the scoring might be. Let's not even try to make even a tentative recommendation on that one until we've had that conversation. Liz, do we have a date for our next meeting?
Yes, ma'am. We have October 9th, 10 a.m. here.
October 29th, 10 to 12 in this room, to work on the second half of that review agenda, and then see if we're ready to pull that together into a full set of recommendations. If we can do that on the 29th, we will. Otherwise, we've got time in November to do that and still be very timely in terms of reporting into the City Council before the end of the year and before the new committees get appointed. Boom, we're going to do that this time. So any final questions or wrap up? Thank you, everyone. This has been rich and full and important. Have a good afternoon.
Thank you.
Christina, you're muted if you're talking to us.
Thank you. Goodbye. Thanks, everybody.
It's the same time, 10 to
10 to 12. Mm-hmm. And I keep looking over at Mike. Mike has the coolest socks on, by the way. If everybody else didn't see them glowing across the room.
Totally saw the socks. I kept looking at the socks too. I was totally distracted.